Greetings and welcome to our channel Health and Beyond Group. I'm Dr. Vaishali, a senior public health specialist, and I will be your host for today's session. Continuing with our discussion on care on the elderly and healthy aging, today we will talk about multidisciplinary approach in care for elderly. To recall about our last episode, we remember that we discussed about the various problems faced by the elderly, followed by a session on stress and wellness. During these discussions, it was understood that care for the elderly encompasses physical and mental well-being. A multidisciplinary and integrated approach is necessary. To discuss more on this, we have on our expert panel Mr. Pankaj Mehrotra and Dr. Shanta Misra. To give a brief discussion of our expert, Mr. Pankaj Mehrotra is a post-management graduate having 30 years of experience through various NGOs, telecom, and hospitality sectors. He has been in consulting role for senior living from Prudential, BPL Mobile, Hutchison, etc. He has also worked for leading organizations in elderly care like HelpAge India. He is passionate and strong supporter for the need to care for the elderly, especially for people with dementia and Alzheimer's. Welcome to the show, Mr. Pankaj Mehrotra.
Thank you, Dr. Vaishali. My pleasure to be on the show.
Mr. Pankaj Mehrotra, we understand that you have been actively involved in the formulations of guidelines on the care on elderly and healthy aging. We also understand that you have personally been taking care of your parents at home. So tell us, which are the priority areas of care that are very important for the elderly as one moves from the age of 60 to 80 and beyond?
Okay, now Vaishali, yes, I've been a primary caregiver for my parents. And my father is 85 and mother is 80. So, as like a regular normal household in the country, it is a duty as well as a responsibility, pleasure, all three of them together to be around your parents and be able to support them wherever they require help. In my opinion, what I have seen is the loss of independence is the biggest aspect as people start growing older. Independence means decision making process. Independence means able to drive, go to the bank, and do all these miscellaneous activities which were like not even taken as a big activity when they were in their 50s, 60s, or even till the age of 70s to a certain extent. But the moment this loss of independence happens, your dependency level increases. So every small thing, my father is calling me up. Okay, how do I do this? My plumber is not coming. How do I do the finances? Things like that. And keeping a supervision on them in the terms of independence is like even to the extent of walking. Like my father, in fact, in the past 6 months, he has fallen down 3 or 4 times from the bed and once or twice from the chair. And twice he fell down in the middle of the night, and we didn't know for almost 45 minutes. So these are the scares which, as a caregiver and as family member, you have to keep looking at it. So that is one very big challenge or very big issue which I see. Second part is the loss of social interaction. By the time you're 80, your unnecessary or unrequired parties becomes lesser. You basically reduce your friend circle, and with today's day and era, WhatsApp and Facebook and all these social media has taken more or taken the forefront of physical interaction. And then what happens as the aging bones happen, your interest to go for walk or climbing down the stairs, that reduces. So automatically that social isolation comes in to a very large extent. So that is one thing which I see, which actually makes them a little edgy, because all their lives they have been used to social interaction, and the moment you are into that age bracket and once you're not in the power of the seat of power, things take a toll on your mental health. Lastly, what I've seen is home maintenance and home management. These are a this is an area which actually becomes a very big problem. Things like my mother when she was much younger, she could climb a small stool and take out utensils, or you can take out cups. But now for every small thing, she says, why don't you take out this thing for me, or why don't you just help me out to go to the market and come. And then small issues like how, if you are living in a house, you have to maintain it. There is a management involved in it. So these are the three main things which I feel are the crux of the thing. I'm not giver. What I am seeing is these are the three things which affects their actual activities of daily living.
Okay, thank
So
you.
that's
That's really very important to understand. Yes, these are very, I guess these are very common accidents that happen, isn't it? Like in a home, wherever you have elderly people and there's a lot of furniture. And if you are not very careful of what you're keeping as a furniture inside the house, you might have your parents stumbling upon and having an accident. Yeah.
yes, and that is one of the reasons I've tried to make the chairs more sturdier, and the sofas at a little higher. I put in
Yeah,
a little cushion over there, because the lower the sofa, the pressure on the legs is much more.
I
So when
see.
you start growing older, you need
Yeah,
that the seat or the chair sofa slightly higher than the regular seat. In fact, that is why you in the bathrooms in the WC you have these
yeah,
seat risers,
yeah.
so that they don't have to really strain on the legs or the knees too much, and it's easier for them to get up. So definitely yes, loose furniture is a no-no. Carpets are a no-no.
Oh, thank you, Mr. Pankaj Mehrotra. I'm going to go forward with your second question.
Sure.
It appears that elderly care requires a multidisciplinary team, as what we discussed. What has been the challenges and barriers to implement a multidisciplinary approach to elderly care? And what are your suggestions on how we can overcome those challenges?
Uh, See, a multidisciplinary team is the most important aspect of planning, because no one person will know everything, and one person should plan it also.
Yeah,
Unfortunately, what has happened is India is still lacking in the professional cadre of people
yeah.
who
Uh-huh.
understand the subject in depth. He is the general duty assistants or the bedside assistants, or to a certain extent nurses. India still has a lot of Rekuma in terms of the training of the holistic planning as to how one the planning should happen, the policy making, and all those things should happen. So yes, it should happen, but unfortunately, there is a trained caregivers. There's a need for trained staff members, which is required. That is one part of it. The priority areas for senior citizens, as well as coming from a caregiver, are, in my opinion, only two of them. One is home care, and one is
Yeah,
residential care. Either you are staying at your house, or you are staying in a senior living facility. So home care is again dependent on the service provider, of what quality and what level of people they send to your house. At the same time, when it comes to the residential living, the assisted living, and retirement communities, again it is a service sector. Again, it is dependent upon the kind of quality of the nurses, the care staff, the dining staff, and other people who are involved in the whole process of care support, which is there. The roadmap can be many. The government interaction and the stakeholders sensitization, everything is there. But till the time the policymakers or the bureaucrats who eventually become the policymakers, if they are not sensitized from at the grassroots level, as a suggestion, my suggestion is that a small module, probably a 1 or 2 hour module at their academy, the IS academy, the IPS academy, and the IRS academy, if a small handout or a small training module of
yeah.
that way, everyone coming batches, all the batches will have a small understanding of the requirements of the aging. So that is one third second part. There is a good lot of good work happening at the at the government level also. You have this Ayushman Bharat, which has developed a lot of training material, and recently this the scheme which has come, that's all citizens over the age of 70, they will be covered under the health insurance. I think that's a brilliant landmark kind
Yeah.
of move. In general, people from the industry, stakeholders, and a little bit of foreign collaboration will help create the roadmap ahead.
Oh,
That's it.
thank you, Mr. Pankaj Mehrotra. That's very interesting. Who do you think should be included in the multidisciplinary team?
See, a multidisciplinary team is ideally it should consist of the whole uh, care uh, care service delivery process, that is starting from the doctors, physicians, the geriatric nurses, because geriatrics is the subject matter for the elderly. So it has to be geriatric focus. So you have to have geriatric physicians, you have to have geriatric nurses, you have to have the social workers, the public health workers, you have to have the therapists, which can be recreational therapists, physiotherapists, occupational therapists. Then you have to have dietitians. Then you have to have psychologists, psychiatrists, geriatric psychiatrists. So ideally, this kind of a thing should be a part of the multidisciplinary team for the care process.
I see.
That's
Okay. Thank you, Mr. Pankaj Mehrotra. Um, your thoughts on the role of family member as a caregiver?
okay. Now, number one, caregiving is a very, very challenging aspect, especially for the elderly. I'm not comparing it to child care, because child care, the level of involvement with the child is different. But by the time we get older, a lot of human uh, personal factors come into play. So it can be very stressful. It can be very enjoyable, in fact, to a certain extent, I would say. But continuous caregiving can take a toll on a person's mental health well-being, as well as the physical health. So my suggestion is that it should be a shared responsibility, if possible, among various members. So, because respite care, internationally, the term respite care came in for this reason, because one single person could not take it. So either the parents were go and visit a short stay senior living facility, or or in-house caregivers are brought in, so that the primary caregiver, the family caregiver, can take a short 1 week or a 10 days break. That is one part. Then I think as a caregiver, like I've been lucky to able to understand from experience that family members should be sort of a sensitized by professionals to identify the aging process requirements. Because a lot of times what happens is the early onset of dementia becomes a serious affair and we don't even realize it. And then it is too late to actually stop. Not you cannot stop as such, but you can take care of the entire dementia, Alzheimer's aging process. So that is one part of it. And second is the other aspects of aging, the requirements which keep changing. We become we are unable to see it because it happens so gradually. So if people are aware of these particular cue points, then it becomes a little easier for caregivers to understand. And lastly, I would say yes, we all love our parents. We all love the person who requires caregiving, but at times they can be unreasonable. For the simple reason is with age, your intellectual and decision making capacities tend to get little wavier, which is a natural process. It will happen to all of us. So one has to firmly put down your point and say this is not possible right now, or I will probably do it later. Never refuse them directly, but just politely say, okay, this is a valid point, we'll do it later. And by the time you actually think about it, they've forgotten the issue. So these are the three things which I feel as a caregiver, person who requires caregiving, should match between the caregiver as well as the person. So that is my learning as a caregiver and being in the sector.
Wow, Mr. Pankaj Mehrotra, one thing is sure here that in spite, I mean, I really appreciate you because you are so lively about this subject. I have seen, parents getting grumpy and, not listening to the children. And it takes so much of patience and challenge for the children, because the parents almost become like children. at this age. And I understand, I think I really appreciate you because you're talking on some subjects which we all know, but we never talk on it. Um, so thank you, Mr. Mehrotra, for sharing your golden experience and thoughts on care for the elderly. We thank you for this whole share full of
My
experience.
pleasure, Dr. Vaishali, and look forward for further interactions and the mutual learning experience.
Thank you so much.
Thank you. Thank you. Thank you.
Welcome, Dr. Shanta Misra, on the show. A brief introduction about our expert. Dr. Shanta Mishra, a doctorate in alternative medicine and a practicing wellness expert. As a health communication expert, she has worked with UNAIDS, WHO, and UNICEF and other organizations in the past. She conducts one-to-one sessions on stress and wellness for corporate professionals, adolescents, and senior citizens. A fitness enthusiastic herself, she continues to motivate all for a healthy lifestyle from an early age. Welcome, Dr. Shanta. Dr. Shanta, you have been a proponent of physical and mental wellness programs across all ages for quite some time now. We now hear from Mr. Mehrotra about elderly care being a multidisciplinary team effort. What are your views on this?
Well, we first came across elderly care during the COVID period, where we saw so many elderly people, even elderly parents of our friends, being left to their own devices and to fend for themselves. It was then we came across the idea of having a course or a program on healthy aging and elderly care. Even our own relatives were, left to fend for themselves, and in the urban setting, literally there was no one who could help them. But it was very scary because a lot of them did not have their own children or caregivers. The idea of elderly people being looked after in urban settings in cities was just unheard of. People had not thought of it. So they were left without a support system. So now healthy aging and elderly care, what does it mean? Healthy aging and elderly care are not separate from each other, but they are complementary. Healthy aging would include physical fitness, as I've already always said, and mental wellness, spirituality, meditation, Ayurveda, naturotherapy, and elderly care is, of course, patient care. And the better the elderly care, the better is the aging and the healthy aging. In the sense, they do have a lot of needs. I'm sure the speaker before me he has already talked about it, that there are multifaceted needs. There are a team of multidisciplinary experts who need to holistically take care of elderly geriatric care. So we have geriatricians, we have nutritionists, we have counselors, dietitians, a host of other, even specialists in medicine. So a multidisciplinary approach significantly enhances outcomes by addressing these complex and multifaceted needs of elderly care. And in a multidisciplinary team, to have a family member, because a family member is the first point of contact. So a family member will also be knows the patient intimately and is aware of the needs of the patient. So it's important to include a family member, and they could be even a spouse or even a volunteer who the person trusts. And such a disciplinary team can be led by a nurse who is aware of the specific needs of the patient. And the team can, run very well, either in a home hospice or in a elderly care setting or even in a hospital.
Thank you. Our second question for you, Dr. Shanta. It is evident that additional training and experience is required for addressing different aspects of elderly care and healthy aging. We also have been discussing about a specific training program on elderly care. How do you think elderly care services can be further strengthened and made available to all our senior citizens?
So when we are talking about a team of experts who are required to, provide care from time to time, it is important that we have clear roles and responsibilities that are defined for them, because otherwise the areas can overlap, and not every area can be covered. So there is also a need for customized care for individual elderly patients, particularly those who are suffering from forgetfulness or dementia or Alzheimer. And these patients need special care, or for management of a chronic illness, as I have said, a specialist in medicine is required. Apart from expert care, there are certain areas on which professionals need training. And these areas include soft skills, but are very important. For instance, they could be communicating with the elderly, because that is a little bit different from the way you would communicate with a young person, or an ordinary person. So the experts need to be trained on learning the communication skills, patience while dealing with the elderly. They also need to be aware of medical aids that are required for the elderly, or medical equipment, or what is the latest in medical care using digital technology. Also, experts, maybe counselors, can help the elderly learn about digital technology, because many are not aware. Many do not, because that will lead to ease of living. Because if you know how to order, electronically, or pay electronically, it helps in the, it creates a ease of living. Day-to-day life can become easier for elderly people. All care providers also need to know about the legal rights of senior citizens, and about elderly abuse, which is not very, there are signs of elderly abuse that one needs to be aware of. So our organization is considering a customized training program on care for the elderly and healthy aging. We have completed an assessment among the general community, who have responded really well, and who are have been associated with providing care and managing elderly family members within their homes, or they have taken care, or they have worked in elderly homes. And our trainings have taken into account the gaps and issues around elderly care from this assessment. We are planning an online modular training that will be open to all care providers involved in elderly care. And we also include details of adopting a healthy lifestyle and healthy aging to others who are not in the elderly group yet. And we will share further updates on this through our YouTube website and other social media platforms.
Oh, wonderful. I think that will really help, because I understand there are a lot of people back in India, in our country, who are trying to access a lot of education to take care of their own parents, because in our society, I think we prefer to keep our parents with us rather than
of course,
keeping them in elderly homes. So I think care will probably be a more important integral part of this, isn't it, ma'am?
There is actually, the thing is that as the parent ages, the child also ages. So when the parent is in the 90s, the child is probably in his 60s or in her 60s. So she herself probably requires care as well. So we actually have a part of our program care, looks after caregivers, how to take care of the caregivers.
Oh my God.
And yeah, they do go through stress, and so all these have to be taken into account. But in India, we have a family system, and in most countries where there is a strong family support, then it is easier for the elderly. Also, this is so, you would know, you are in France. I'm sure people go out on what is healthy aging, where they actually enjoy life and are motivated each day or inspired. And they also like to, just generally talk to one another and be in touch with people. Though we are more used to the digital age, they are still, they like to visit people and see everybody at least once a day, go out, talk to people, buy flowers, etc., buy vegetables. This is how they like to. So this is all part of healthy aging. You can't take it all away from them and just keep them in a sanitized room and expect,
Exactly.
that
Exactly.
they are old now.
Yeah.
They don't want to do that.
Yeah.
They want to meet their grandchildren. They want to talk to young people. They laugh. They're very non-judgmental anyway. So all that helps.
That's a very important point, Dr. Shanta, that you just said about the care of the caregivers. And I remember, I will just recall an incident here because my father-in-law was suffering from Alzheimer's. And the last years that my mother-in-law had to take care of him, she was quite very exhausted because, she's also old. And I remember this point where she went to the physician telling about everything. And the physician talked with my husband, her son, saying that, you know what, in most of the cases, we say that if the caregiver has to be uh, in a constant situation of taking care of their partner, sometimes it's the caregiver who loses life before the index person. Yeah. So they said that here you have to always think about the betterment of each person. So because
we have a
Alzheimer's,
separate course. We have a full separate course which we are doing care of the caregiver. So there are.
Thank you about that. Thank you about that. Caring for the elderly necessitates a trained multidisciplinary team approach, with each member's role clearly defined based on their expertise. A holistic perspective is essential, addressing both physical and mental well-being. Family involvement in elderly care is crucial and requires special emphasis. Family members should be sensitized and trained to effectively participate in the care process. Periodic training for all care members is vital. In addition to updating knowledge and skills specific to their expertise, training should cover communication skills, empathy, patience, and the use of technology, as what Dr. Shanta said, across all the disciplines. Policymakers also need to be informed about the evolving needs of the elderly to ensure that policies remain relevant and effective. With this, we end with our second session on care on elderly. Hope to meet you soon again. Thank you all.
Thank you. Thank you.